Hi, welcome again. This is Dr. Carl Hansen of Infinity Health, and we want to give you another medical topic discussion today. As many of you know, I often have medical students work with me during the course of the year, which I enjoy greatly, and they like to give presentations and discussions about various medical topics and other issues. So today I have with me Michael Kelley. He's from LSU Medical School in New Orleans, class of 2019. So I've had the pleasure of working with him this month. And Mike would like to present some topics on X-rays, etc., various tests that we do a lot of. And so we thought it may be a good idea to give people an education about a basic testing set that's often done. So I'm going to go ahead and hand it over to Mike right now and let him give his presentation on that.
Thank you, and thank you for letting me work with you for the past month. I've really enjoyed it here.
Sure, my pleasure.
So, a little bit about an X-ray, and it was first discovered in 1895 by a German physicist named Wilhelm Röntgen, and he discovered this incidentally during another experiment. He didn't understand what the invisible light was, so he named it X, as an unknown X-ray. So an X-ray is a form of electromagnetic radiation. It's just like visible light, just as you can see Dr. Hansen and I right here, right now, but it just has a lot higher energy. So because it has this high energy, it allows itself to pass through structures within the human body. So as an X-ray passes through the human body, three things can happen. It can either be absorbed, it can either pass completely through it, or it can partially pass through it and be partially absorbed, causing a scatter in the X-rays.
So for something like this is a model of a shoulder blade and the bottom part of an arm bone. So as an X-ray is passing through this, the X-ray can't make it through the bone, and it eventually gets either absorbed or bounced off. But maybe the muscles surrounding the shoulder, then the X-ray can actually just pass directly through. That's right? Correct. All right.
So whether or not the X-ray passes through depends on the density of this structure. So a bone is very high in density. It has a high atomic number, so the X-ray cannot pass through the bone.
It has a lot of calcium and various other things in it that we can't penetrate through, whereas the muscles and stuff around it have a lot of water and things. So okay.
So in an X-ray, there's 5 basic densities that a radiologist looks at. The least dense is air, which on an X-ray is going to appear the blackest. The most dense is mineral, like bone. The densities in between are fat, soft tissue, and fluid. So on an X-ray, like a chest X-ray of the heart, you cannot tell the blood inside the heart from the heart itself, which is soft tissue, because their densities are about the same. And then there's mineral, which is bone, and then there's metal, which are things like foreign objects, like a hip replacement or a knee replacement. And these metals are going to appear the whitest on an X-ray because they are the highest in atomic number, they're the most dense, they have the most electrons, just for some technical aspects.
So as the X-ray can't pass through the metal, it shows up on the film or the image as white, and that's indicating that it can't pass through. So the white doesn't mean it's really hot per se, it's just that that's just a negative part of the image. It's kind of a backwards sort of deal.
Yes, sir. So since X-rays are ionized in radiation, there are some risks associated with them. There's always the risk that cell mutations can happen, so we kind of recommend against using X-rays during things like pregnancy to avoid teratogenic effects. So now I'm going to talk a little bit about CTs. So CTs, are commonly known as a CAT scan, or computed tomography, were first discovered in the 1970s by Sir Gregory Hounsfield. So a CT is similar to an X-ray in a lot of aspects. A CT actually uses an X-ray beam. So in an X-ray, we only get a two-dimensional picture. So if there's a lesion in the lungs, we know that there's a lesion there, but we don't know the shape of the lesion, we don't know how deep the lesion extends. So we can use a CT scanner to build a three-dimensional model to kind of get a better understanding of the size and shape of that lesion.
Yeah, the model, William Röntgen doing his original X-rays, didn't have computers, so he couldn't really do much with that. So really, CT scans, computerized tomography, could only come about after computers were developed to process all this data rapidly. So that's why, yeah.
So a CT scanner has an X-ray beam and a sensor, and the X-ray beam shoots towards the sensor, and it rotates 360 degrees around the patient inside it. And so this allows multiple different pictures, multiple different X-rays to be taken simultaneously to allow us to build that soft tissue 3D model so that we understand the shape and size of what's going on.
And you say that's not to interrupt you, that's a relatively quick study, fast procedure?
Yes, sir. So this CT scanner is hooked up to a computer, just like Dr. Hansen mentioned, and we can take hundreds to thousands of pictures in a very rapidly fast pace. So this is why CT scanner is very beneficial, because it can be done very quickly.
But I imagine with all those images, there's probably more radiation delivered of a CT scan of the chest than there is of a routine chest X-ray of the chest. Has a lot more radiation associated with a CT scan.
Yes, there is. That's correct. So a CT scan has a bunch of different pixels within an image, and these pixels are called Hounsfield units after Sir Gregory Hounsfield. So they range from minus 1,000 Hounsfield units to plus 1,000 Hounsfield units. So minus 1,000 is the least dense, which would be air, and plus 1,000 is the most dense. For reference, water is about 0 Hounsfield units, and bone or mineral like calcium is about 500 Hounsfield units. So now I'm going to talk a little bit about MRIs. So an MRI uses magnetic fields and radio frequency pulsing. So the body is mainly comprised of water. It's 70% water. And MRIs take advantage of this fact. Water has a lot of hydrogen in it. So a hydrogen atom, which is basically a proton, is used for imaging, and we take advantage of the potential energy stored.
And not to interrupt, a little background on that. Back when MRIs were first developed, they were called NMRs, nuclear magnetic resonance imaging. But people got spooked by the term nuclear, so they changed the name from NMR to MRI. But yeah, they have nothing to do with nuclear energy or anything like that. So that was good they changed that, because people kind of got scared about that.
Yeah. So MRIs are actually very safe. They do not use ionizing radiation like an X-ray or a CT scanner. So there's no risk of cell mutations in that sense. The only risks associated with an MRI are with maybe like a cardiac pacemaker inside the human body, or things within the MRI room like an oxygen tank that may be left unnoticed in the room.
Right, yeah, you're actually sitting inside a big magnet that's turned on and off. And so if you have certain types of metals in you, it really wouldn't work.
So this big magnet takes advantage of the hydrogen ions. When the magnet's turned on, the hydrogen ions, just like protons, align with the magnetic field. And once they align with the magnetic fields, we use radio frequency pulsing that causes the protons to all realign 90 degrees or 180 degrees with the axis. And then we turn off the pulsing, and the protons relax back to line up with the magnetic field.
Yeah, that's pretty advanced physics, but that's stuff that's really interesting. So if you kind of want to have any physics background and want to springboard on that, it's really interesting stuff.
It is. So MRIs are the cornerstone of neuroimaging. They allow us to really enhance the contrast between things like fluids and soft tissues. So this allows us to better visualize the brain. It can also allow us to better visualize things like soft tissue, muscles, ligaments, tendons, and it's considered one of the diagnostic gold standard in things like this.
And I sort of point out, so just so everybody knows, so a model of a human body here, a very small version. So we talked about X-rays for bones, etc., and certainly the ribs are removed here, but what you're looking at are lungs and liver. Well, routine X-rays aren't going to really see anything of that. But what Michael's talking about is that the MRI is much more beneficial at picking up detail at some of these soft, squishy things, and pick up a lot of abnormalities in it, where a regular X-ray, or in some instances a CT scan, couldn't even do. So yeah.
So I talked about some of the risks associated with the MRI. One of the other downsides of it is it takes a long time. It takes about 30 minutes to obtain an MRI scan. The patient is usually in the scanner for about 30 minutes, which, as opposed to the CT scan, we can obtain very rapidly, and we can collect a large amount of data very quickly to better visualize what's going on inside the body. So MRIs also, because it's a huge magnet, have a very high operating cost. They require their own special designed rooms to be placed in, so they are very expensive, which is also another downside of an MRI. And that's just an overview of some of the common imaging modalities.
All right. Well, thanks. If you have any questions about any of these things, give me a call. If we're ever doing a test run, you give me a call. But this is important information because these are tests that are done a lot, and I think it's good for patients, consumers, and everybody to understand what's being done, why we're doing these things, because educating the patient is really important for this. And so that's why I appreciate Mike bringing up this topic and thinking it was a really good idea to bring in, and I agree with that. So yeah, so thank you very much, and I'll...
Thank you for having me.
Sure. All right, appreciate your help. And y'all make sure you tune in, and don't forget to subscribe to the YouTube channel. We'll be putting up other videos, and all I can ask is keep your ears and eyes open and pay attention to look for Mike Kelley's name out there in the medical world somewhere doing good things. So, all right, thanks again.